So hopefully you can see my screen, and I'm going to begin the presentation. So first, before I get going and talking about our MBA, I want to just tell you a little more about the school and our story. We are the first business school in the world totally dedicated to health and healthcare management. We just launched in the past year, and really it's about the fact that, health and healthcare are so important, and they play such a pivotal role in terms of our economy, our society, our well-being, and are becoming more and more important as we go forward. There's a number of reasons, of course, in places like Europe and Japan and other parts of Asia, we've got aging populations. And as the vast majority of our population ages, of course, they'll need more health and health care. But we also see other areas, even in lower income countries, they are struggling often with not just communicable diseases, but non-communicable diseases such as heart disease, diabetes, strokes, cancer. And many of these diseases, these chronic diseases, are really, require lots of resources in terms of healthcare. And then last but not least is, of course, our well-being, our mental health is becoming more important. So as healthcare evolves and countries spend more on healthcare, they also need to think about how they address that, how they manage that. So using a lot of the old models that we've used in healthcare management, they're just no longer applicable. And we see a move more and more towards digital, but what does that mean? How does that make a difference? So these are all very important questions, that we've got to answer. And so looking at business schools and business education, health has not played necessarily a prominent role. And thinking about health and healthcare just in a public health perspective isn't enough today, particularly with the focus on prevention, on diagnostics, on patient monitoring devices. So more and more we need to then think about a new way to reimagine global healthcare. And that's really what the Global Business School for Health is about. It's about educating the next generation of health professionals, about helping people pivot into health who maybe never thought about this as a career option. So our MBA is really our flagship. It makes up a real important part of what we do here at the Global Business School for Health. Business and medicine definitely sit next to each other, and also bridging that kind of bigger, wide health ecosystem. When we think about healthcare today in the health sector, we think about biotechnology, we think about the pharmaceutical sector, we think about digital health, whether that's health tech, med tech, and genomics, and all of that then, and that way that we deliver them, the kinds of pathways that we put together really call for a different way of thinking about the MBA. So general MBAs give you lots of background in different parts of business and management. This MBA, this UCL MBA in Health, will give you all of those components. It will teach you the business and management, but it will also go one step further. It has health and healthcare built into the DNA. So when you have questions, when you're doing cases, when you're working through this program, you will be getting ample examples from health and healthcare. We want to make sure that the students from this program can assimilate, can digest lots of information, lots of data, make decisions, make very courageous decisions in a very confident way. And the only way we can do that is by having opportunities to maximize their engagement with the sector. So, really harnessing, not just from a medical perspective, but from that wider health ecosystem, and bringing lots of people from lots of different backgrounds together. So, often when you're thinking about doing an MBA, there's lots of conversations to be had. And those conversations are really important. It is important to talk to your family, to your friends. It's a big commitment to do an MBA, and you want to be able to really get the most out of your program. So when you're having those, it's, what are the things that really are important? Well, MBAs, and I, just earlier this morning, I was on a call with someone in Germany who works in marketing of healthcare for a very prominent multinational corporation. And this individual told me that, prior to doing their MBA, they had never really even thought about health, but the opportunities, the kind of transformational experience that an MBA offers you, really put them on a very different kind of career trajectory. So it will open lots of new career opportunities. It will create self-reflection and personal development that really will build your self-confidence. And I guarantee you that regardless where you're at right now, it will accelerate your career. So it's really that shift from also thinking about your individual contribution to managing others effectively, being an influencer, knowing how to negotiate, understanding not just your leadership style, but how you can change your leadership style and influence other people and negotiate. So it's really about the potential of building a portfolio career. It's about, pivoting your career. It's about accelerating your career. All of those things are the things that drive people into MBAs. And it is looking for those experiences that really go beyond and create you as an individual. The reason it accelerates your career is because you become much more confident. You deal with lots of different cases and activities and experiences in a very condensed time. So I really think of the MBA as a boot camp. It's really a training for you and ours in particular in terms of healthcare management. It's able to get loads of information. You will work very hard. It will be a series of sprints. You'll learn lots of technical skills, but you'll also gain lots of soft skills. And it really will create a different you. The kind of credibility, the ability to really take your career forward. So who are we targeting and when should you start? Well, there's really 2 points in your career where people mainly do an MBA. It's early on in your career. Sometimes, just within a few years after you really completed your first degree or entered into the job market. And then later on in your kind of mid-career, when you're looking to reboot or accelerate or move up to the next level. And why is UCL so right? Well, first of all, there couldn't be a better university in the world for such an MBA. UCL is not just ranked 8th in the world and #1 in research in the UK, but we're truly a health, medical, and life science university. Probably 70% of what happens at UCL happens in this space. So this is a real cross-disciplinary department. We all are focused on training in leadership, management, and business, but all of us come from various backgrounds to pull that together. And those are backgrounds in health and health-related topics. And then we also tap into the wider UCL community. So we have really a very rich resources and individuals teaching, different parts of each module by a real group. It's not an individual instructor. It's a group of real leading professionals in the business of health. So that really is what makes us stand out. It's that understanding of the healthcare sector, health not being an afterthought. It is what we're all about. And our programs are specifically designed to build healthcare leaders for the future with really cutting edge. All of our programs, everything we do in the Global Business School for Health is thinking forward, thinking about where we need to go, how we need to train you to make sure that you can really add value. and that, the degree that you get from us is money for value. We've got a fantastic program that'll be available for MBAs. It's called Executives in Residence. These are health professionals, CEOs, former CEOs, senior leaders who are ready to mentor, engage with you. You can book office hours with them each semester, and they will give you career advice, help you with kind of decisions, just an opportunity to reflect with someone that knows how to move and accelerate and build a career in this kind of health space. We'll also be working with a recruitment agency. They'll be coming in at the very beginning, giving you a number of kind of personality psychometric tests so that you can understand who you are, where you're going. Also visualizing, what do you want out of this MBA? Where do you see yourself, after it's all over? We want to work with you from day one to make sure that you get the career outcomes that you're anticipating from such a program. And then, of course, UCL has a list of alumni who are really prominent individuals. Many of our executives in residence, by the way, will be UCL alumni, and they are so eager to really help you. And you also have an opportunity to come back at a much, much reduced rate to take any kind of lifelong learning throughout your entire career with our executive education unit, whether that be residential courses or online courses. So we want to make sure that this is something, a partnership that's for life. And then there's also, of course, the networking opportunities, the speakers, the people that you'll meet as you do your projects, as you go out into the community on your various field trips and studies. So this is just a holistic experience. And as I said, typically, who do we expect to come onto this program? Who have we been, recruiting? Well, people who are early in their careers, mid-career. Either they've got a good academic background or clinical background or work experience. But more importantly, it's about your attitude. It's that ambition, that determination. It's for people who are really looking to build up knowledge in healthcare management, pharma, biotech, and with an eye on accelerating their career. So it's not so important to us what you're doing now, but it's that ambition around health and healthcare that will really make a difference for you on this program. And just to, highlight what do people, often I get asked, where do people with a health MBA go? Well, they go into often management consultancy with some of the big four consultancy firms. They might work in biotech, pharma. And of course, as this sector keeps expanding, these opportunities expand. As we know, big tech now, is into health. There's almost not a company who doesn't see this, a multinational that doesn't see this sector as a huge opportunity. So the list of companies and places and things that you could do with a MBA in health from UCL is endless. But there are really opportunities for you to shape that destination as you go through the program, shape it with us, and get the outcomes that you really want. So what's the program like? How does the program work? What's it going to feel like when you come onto this program? So first of all, it's really designed to strengthen your ability to, as I mentioned, to really be a decision maker. You'll work with a team of academics who will really help you become the very best you can be within the 12 months that you're on this program. So the program starts out with a very comprehensive induction. You've got 2 weeks that you'll come in, and actually, let me fast forward back just a bit. Before you even start your 2-week induction, we'll ask you to take a number of online modules, and these are being custom made as I speak for you. So there's one in global health. There is going to be one that covers kind of a boot camp in finance, accounting, and economics. There'll be one on study skills, time management. These are all really important, what we call primers. So particularly if you've been away from school for a while, or maybe you come from a background where you haven't gotten a lot of finance. Maybe you come from a background you don't know much about global health. That is completely okay, but these are there to help kind of level that playing field, give you a little introduction to the program, an opportunity to really see and learn prior to actually starting in any of the modules. Then we'll bring you for 2 weeks. Within that week is a 3-day residential. We'll take you away off campus as a group. That is, it's all built into your tuition. And you will have an opportunity to hear from a number of speakers, start to discuss, learn how the MBA is going to be taught. So you'll start to work on some cases together. You'll be taken through, so you'll understand how you do the readings for the case, how you prepare for the cases, how the cases will be played out within the classroom. You'll also have some interactive activities. And then you'll also get, prior to that, your personality test. You'll have individual one-on-one with the consultant to kind of feedback the outcomes of that. You'll be placed in teams for your first project, which is the Global Health Challenge. So it'll be a very busy 2 weeks with lots going on. And the intention is really to onboard you to be successful on this program. Now, then the next thing is, well, how's the program delivered? Well, the program is delivered in 4 30 credit blocks. So it's quite chunky. So you'll have an online material before you start each block. You'll have readings, you'll have videos, you will have cases that you're to review and prepare. Then your first 4 weeks are called strategy, people, and marketing. How that will work is you'll come in, you'll have the first week. So it'll run 4 days across the week. We're anticipating it will be timetabled in the afternoons. So from about 1 to 6 on those 4 days, the first week, you will have very intensive sessions on strategy. You'll have, you'll present the cases, you'll discuss the cases with the instructor, you'll have speakers coming in, you'll have interactive activities. The next week, same thing, it'll be the people week. You'll have done the readings, you'll have reviewed the cases, you'll come in 4 afternoons of that week for 5 to 6 hours, really working through that material, and then marketing the same thing. And then a final 4th week we'll call wrap-up week. And that's really a week where we're going to bring in various people who work in strategy, who work in HRM, human resource management, who work in marketing and healthcare, to really talk to you about their experiences, to bring their real life experiences and cases in, and to work and challenge you as you finish up your assignments for that block. Then you'll have a 2-week kind of break between, not really a break, but 2 weeks to prepare for the next sprint, which is funding, finance, and regulations. Again, you'll have a week of accounting and financial reporting, a week of corporate finance, and then a week of policies, health policies and regulations, and then a wrap-up week. Now, alongside this, you'll have started your Global Health Challenge. You will have been placed in a group. You'll meet a team of academics and have some industrial mentors as well, who will start helping you. What that project will be on is finding a health solution in a lower middle income country. We're exploring some projects right now that you would be working on. We're looking at possibly something in the Middle East, India, and something in Africa, possibly Nigeria. And you would be working on those projects, both with people in country and at a UCL. So in January, after the new year, you would go ideally at that time, to that country, or you might go at the end of term 2, depending on the project and agreeing that. Those 2 weeks, you'd be in country doing kind of a field experience. You'd learn about the health system there. You'll be interviewing, collecting data for your project. And then you'll return. And then in kind of mid-January, you'd start your third block. The third block's called data-driven management. That block is really, you've got a week of kind of health economics, a week of health analytics, and then you've got sustainability in healthcare, and then again, a wrap-up week. And then you've got 2 weeks to prepare for your final block. The final block is called contemporary topics in health and healthcare. You'll have some electives that you can choose from. So not everyone will take the same blocks, the same things. And you will pick 3, and then you'll have your final wrap-up week. Then in the final third semester, that will be the time that you and your team will finish off your global health challenge project, write up your report, and also prepare your presentation that you'll give in August. And you will also begin a health consultancy project. This is a real world project. You'll be working with companies or NHS trust. You might be working with a private charity. So there'll be many options. We'll get the consultancy projects for you. We'll have agreed those. You'll work with your career coach to decide which one fits best with you. Depending on which project you're working on, you might work by yourself, you might work in a small team. So there are many different ways that you can engage in that project. So that's really a snapshot of how the program runs. It's quite intensive. It's full on, it's a lot of work if you take it full time. You can take it part-time, and if you're a part-time student, you would just take 1 block in term 1, 1 block in term 2, and you would pick one of the projects that you would do in year 1 and one of the projects that you would do in year 2. So that's how it would work. And happy to have any kind of further discussion about that option as well. So just to talk a little more about the Global Health Challenge. The whole idea of this project is to help you get experience and understanding of what it's like to work on a global health consultancy project. So these projects are in low and middle income countries. And the reason is because being a UK university, we can be very Eurocentric. And so we want to make sure, as the Global Business School for Health, that you get a wide variety of experiences beyond the classroom. And so part of that is then also understanding the challenges as well as the opportunities of doing kind of these sorts of projects in low and middle income countries. The project will really culminate with a research paper that you'll be putting together that's with your colleagues as well as your presentation. But the project will be supervised, you'll have academics, but we'll also be consulting and working with people on the ground in that country, as well as people in various organizations. So you're going to meet just a number of people, as well as get to know your colleagues much better as you work as a team through this project. So one of the things also that we want you to get out of the Global Health Challenge is how to be on a really diverse team, how to work with people from different backgrounds. I often hear students complain sometimes about group work, and yet what they don't realize, and for those of you who have been out and worked for a while, actually teams and getting different ideas and working with others is paramount to actually driving good decision-making forward. So learning how to do that and how to be a high-performing team is part of our ambition with this project. So you'll have workshops. We'll be checking in with you. You'll also be expected to make and understand your contribution as a team player, whether it's in a more kind of leadership directive role or whether you're assisting others. And we will be reflecting back to you on that experience throughout your journey. So it's a fabulous opportunity not only to learn about a specific health system, to learn how to problem solve and come up with a solution, how to write it up in a kind of research format, but also to develop your personal leadership and management skills in working with a group of people from different backgrounds. And that's why we put you in the team. And it's a very thoughtful process that will do that through using, the what we know about you in those early days. The other thing is, the same thing with the health consultancy. So why do we have you do that project and then also do a health consultancy? Well, the health consultancy is quite different. It's actually, you'll get a brief we'll have a number of briefs that you can help, and you'll have the opportunity to give your preference. And as I said, ideally working with us and our career coach to find what would be a good fit for you, not just thinking about doing the project, but also where you're going to go as your next step in your career. But it's how do you, work to a brief? How do you get those deliverables? How do you work with an organization, a client? So this will really build your client skills as well. And then producing that kind of client-driven outcome and project. And so again, it will be quite structured, but it will also give you an opportunity to really understand yourself as a consultant. And these projects will not just be in the UK, we're working with organizations across the world. So again, just, as I've said, this really is a program designed for ambitious individuals, people who are really determined, who want to be exceptional leaders in the healthcare space. So you can be a manager, a clinician, a business specialist. We're less concerned about what you're currently doing, but more concerned about your ambition in this kind of healthcare management leadership space. And so if you're thinking about pivoting your career, you don't know much about health now, that's okay. You're going to learn a ton when you come through this program. So I now want to turn and talk to the admissions requirement, because we get most of our questions actually are not about the program itself, it's about the admissions process. So you do need to submit your academic record. Sometimes I have students or individuals come to me and they say, prospective students, I haven't been in school for 10 years. When I was in school, I wasn't a great student, but I've done so much since then. Well, you need a 2-1 or equivalent, but we really on the MBA, we're going to look at, you as an individual. We're going to look at everything you do. So if you don't have a 2-1, but you've got extensive relative work experience and you feel that you can make a case for yourself, please apply. Don't hesitate not to apply, because we're looking really for much more than just a grade point average or a classification on a bachelor's degree in this program. That's why we've got lots more things that you have to do or evidence, but look at it in a very positive way. The reason we're doing that is because we want to see all of you. We want to get a picture of you as an individual, and that's how we're going to make the decision, not off one individual component here on this list. And I just can't emphasize that more, how holistic the MBA entry and admissions process is. It's a very thoughtful process. You do need to speak English. Of course, we're an English speaking institution. So you'll need at least a 6.5 overall on your IELTS and a 6.0 in your sub areas. We're looking for work experience. You should have a minimum of 2-3 years work experience. But if you've got a little less and you can evidence that you've worked alongside your degree, or you've done volunteering or have other experiences that you can bring to the table, put them into your CV, talk about them in your personal essay, and we will factor them in. If you've got lots of work experience, please really highlight that. We want to understand who you are. We do expect you to take the GMAT score, have a GMAT score or a valid GRE score. If you have a reason why we should waive that, please reach out to us and we can have a chat about that as well. But the reason we have the GMAT score is it helps you understand your abilities and it helps us understand who you are. So we're not looking for a specific score, but we're looking for a well-balanced score, particularly in terms of thinking about this program as something where you're going to have to assimilate lots of information in a very short period of time, preparing cases and being able to do that effectively. Also, every candidate who meets the entry requirement will get an interview. This is an opportunity for us to get to know you a little better. You can also set up an informal interview ahead of time before you submit your application with myself. But the interview will have a set of questions, and I'll get to that in a minute. And of course, your personal statement is just so important for us to understand and get a snapshot of you and why you want to do this program, along with your 2 references that are required. Again, just a little more on the GMAT exam. There's lots of information. You can take the exam online through GMAT. There are also opportunities to prep for it. There are also free online practice exams that you can take. And the best way, I think, for preparing for it is just that, going on, finding some practice exams, taking them, getting comfortable, and then taking the online. But I don't want people to, feel overpressured about this exam. It's an opportunity just for us to get to know you more. And then the interview, which will be the final kind of component in getting accepted onto the program. So what we've tried to do here is just list what most of the questions that you'd be asked. So again, tell us about yourself. If you interviewed for a job, you should be able to understand the kinds of questions that you'd be asked. Why the MBA? Why this MBA? The Health MBA? What makes you a standout candidate? How you see yourself contributing to the program. So this isn't just about you. We're looking to really build a class. So how do you see yourself? What is the contribution? How do you see yourself fitting into this program? We want to understand your expectations of the program so we can make sure that they're realistic and something that we can deliver on. We want to make sure that anyone coming on to this program has a very positive, realistic experience. And so we want to be as authentic with you as possible. What's your main strengths and weaknesses? All of these questions are really important. And then I also want to make sure that all of you realize, yes, the program is expensive, but we recognize that and we want to help make it as affordable as possible. But it does cost us as an institution a lot more to run such course. Every module you will not have one instructor. You'll have a team that's teaching you and working with you. We'll have lots of guest speakers and opportunities, site visits. And so all of that then comes into play in terms of how we set the tuition. But we've got a really unique scholarship. It's our MBA Health Futures Impact Scholarship. And you can all apply for that. It's up to $15,000. We're going to be giving a number of those scholarships to exceptional students undertaking the MBA in health. You need to apply for the MBA, but at the same time that you're applying for the MBA, you can also apply for the scholarship. You can find more details about how to apply for that on our website. We've also got a Women Healthcare Leader Scholarship, which is an opportunity for females to get up to £5,000. And again, all of these figures, they will go to help subsidizing your tuition. And this also is very exciting because if you get this scholarship, you'll also get mentoring and coaching. There'll be a program for really helping to prepare women for leadership roles in healthcare. And that's something woefully needed. Women make up 70–80% of most of the healthcare workers across the world, and yet they make up a tiny portion of actually the senior leaders and decision makers. And so we want to do everything we can at the Global Business School for Health to address that. And then last but not least, our new campus will be at UCL East. which is on the on the Queen Elizabeth Olympic Park. It's a beautiful setting. The buildings are, of course, being built as I speak, and they are wonderful. And we've got a scholarship for individuals from East London in recognition of our local community. So in addition to this, I'd like to just mention there are lots of opportunities. UCL has a scholarship finder. Go on, take a look at that. We've also offered some separate sessions on funding and scholarships. If you're an international student, and of course, if you're a home student, you can work alongside up to 20 hours a week while you're doing your MBA. That can be an important opportunity, not just a source of income, but an opportunity to really, get further work experience here in the UK. Also, if you're an international student, you can apply for the kind of post-study work visa that will stay on for up to 2 years after your MBA to work here in the UK. There are lots of international scholarships through various organizations. I suggest you contact your British council in your home country. If you're coming from the US there's federal funding that you can apply to. If you're a UK student, you can apply for postgraduate loans. There's also private loans that you can apply to for an MBA. That you can Google, loan funding for MBAs that are available as well here in the UK to kind of put together your package. So it's really, when you think about how you're going to fund it, I think it's thinking about all of that and setting down and making a budget. How much can you individually contribute, either through work or savings? How much can you get in terms of loans? Where are your scholarship opportunities? I really would say anybody applying to this program should apply for one of these, MBA scholarships, the Future Leaders. It's a really, I think would be complacent not to apply for it. So there's lots of opportunities here to fund your MBA with us, not to mention that after you finish it, the kind of career opportunities that you'll have are immense. So again, just thinking about that career support, you will, of course, have your self-learning, your online primers, the classes that you'll take, that induction, all through it from the very beginning. We have excellent career services at UCL. We'll start to engage with you right from the very beginning. We've also got innovation in enterprise services. So if you're thinking about a startup or going out and launching into something on your own, you'll have those opportunities. So developing you as a person is going to be integral to this program. And then finally, I don't want to lose sight with all of that just being a student at UCL is a fantastic experience. It is really a special place. And there's the student union. I'm really hoping that, our students in our MBA will set up a MBA Health society. There's clubs, there's sports. It's really an opportunity for you to have just a great time. The program itself is going to be so exciting, so fun. Your mind is just going to be full of different stimulants throughout. There's also opportunities to volunteer and ways to connect to not just other students, but organizations, charities. Really, if your passion is health, there's so much that you can do. And then last but not least, I want to just mention our student support and well-being. We've got a fantastic team at UCL. If you've got any kind of disability, whether that's a learning disability or another type of disability, they're there to help. They have counseling. If you're experiencing any kind of mental health issues or just need some general well-being support, they're fantastic. So between the student union, the students support and well-being, our student experience team, our MBA team is just there for you. and will be supporting you along the way. And you know, that kind of relationship that we will bridge with you as a student in our program is so integral to everything that we're going to be doing. We want to make sure that you have a great experience, that this is really a life-changing transformational experience, not just transitional. And then I just want to talk a little bit. There's our campus. Isn't it beautiful? There in East London. It is, as I mentioned, it's on the, you know, former Olympic Park. You know, we will not necessarily have the MBA in that building. It's being built, but we will be in East London, and you know, the sister building will be built there, you know, for September 2022. But East London itself is just a fantastic place. It's got state-of-the-art facilities. There's student housing. There's, you know, the kind of East Bank culture and education destination, shopping. So there's much that can be done in East London. And then, of course, life in London, moreover, and the separation by train is about 8 minutes from East London to St. Pancras, in the heart of a central part of London. And you know, UCL is not, you know, it's one organization. So whether or not you're being taught in Bloomsbury or if you're being taught in East London, it's all UCL. And UCL is part of this vibrant London society community, you know, fabulous parks, greeneries, you know, museums. Most of the museums in London are free. There's galleries, there's institutes. It's a great place to be a student. And as you can see, it's been ranked, you know, one of the top cities for students in the UK to be at. So you'll have a fantastic time just being in London as a student on this MBA, and the opportunities, the people you'll meet, and the networking will be tremendous. So there's just a list of upcoming events. This is just one event that we do. As I said, there's also, you know, the MBA Health Showcase and the event around funding and finance. We've also just want to highlight, we've got a fabulous webinar next week, January the 19th at 1 p.m. called Universal Health Coverage for All, A Question of Finance. I think anybody contemplating this MBA would find that a wonderful event to attend. It's free. We've got speakers. We've got a former health minister from India. We've got a professor from Johns Hopkins University, a professor from UCL, and we've got someone who has a very successful health consultancy in Nigeria speaking. So you really get that flavor of what Global Business School for Health is really about. So there's our website, our email address. Please do, you know, email us. Let us know your thoughts, your concerns. I'm now going to turn now for the next kind of 15 minutes to our Q&A. Again, thank you so much for taking the time listening to me. I'm going to stop sharing my slides and move over to the Q&A now, but thank you. So let me just start here and go through these. What are the modules and topics taught? Well, as I just mentioned, this is a really comprehensive program. And so you take, you know, 4 blocks. I wouldn't call them modules, but they are 30 credits, and they cover, each one covers three topics, themes, as it were. The first one, of course, is strategy, you know, people, which is human resource or organizational behavior, and marketing. And then I mentioned you have your wrap-up week. So and then the next one, of course, funding, finance, and regulations, you know, and the themes there are corporate finance, accounting, and financial reporting. And then, you know, the policies and practices in healthcare. And then the third module is data-driven healthcare. And again, you get health economics, data analytics, and you get sustainability in healthcare. And then the fourth one, those contemporary topics, again, we're looking at things like systems leadership, digital health and innovation, and operations. And so those will come shortly in just actually probably in the next month of those choices. But students would have a bundle of themes or courses or weeks that they can choose from. So and they're very intense. You'll spend about 20 hours in a week, not to mention the work you will have done online preparing for coming in for doing those. And then of course, you've got the two big projects, the Global Health Challenge and also the Consultancy project. So again, happy. And if you go to our website, you'll see kind of a chart of each term and what it involves. So has COVID impacted how you're delivering the program, the residential? We don't anticipate that to impact the residential, and this is really a face-to-face program. UCL is, and I realize, the pandemic's quite serious and it's had some impact, but UCL continues to teach face-to-face, as well as have, some hybrid online modules. We anticipate that will continue going forward. And anything, like the Global Health Challenge, if anything, if we had to move that from January to say June for the trip, that would be the impact. But I'm hoping as more and more people get vaccinated, and we will, of course, assess the situation as a university. We have an operating model. And we will hopefully continue to be able to provide face-to-face instruction along with online. We use just generally in the Global Business School for Health what we call a kind of flipped classroom. So when you come to class, it's quite interactive, it's hands-on, and most of your lectures will be online. And of course, there'll be guest lectures that will be face-to-face, but it's really an opportunity of not giving you less face-to-face time, but making sure that the face-to-face time you're working on cases, you're really having an opportunity to speak, to articulate yourself, to develop yourself in a very confident way. What is the work commitment for part-time? Can you do this easily alongside employment? I think this is our face-to-face. In 23-24, by the way, we'll be launching executive education, an executive MBA. That will, like I said, we won't take our first cohort to 23-24. That one is almost all online with, and is really designed for people in work. It's only offered as a part-time or flexible option for an MBA. And but this one you can do part-time, but you definitely have to have your employer understand that you'd need a month in the autumn, where every afternoon in that month you would need to be able to be on campus, and you need that month in the spring. And then depending on which year you do your project, your Global Health Challenge, you'd need those 2 weeks where you'd be abroad. And in your first year, you'll need also the 3 days for the residential. So I think it is doable as long as your employer is on board. You do it over 2 years. You would take, like I said, 2 blocks and a project each year. As long as you can get that commitment from your employer, if you need any help, explaining it, putting it into a document about just the time commitment so that you can take that back to your employer, please let us know. Does this MBA cover any focus on mental health? No, it doesn't directly, but it does indirectly. We in the broader sense of health and of course behavioral health, many of the systems, and as we all know, particularly when we talk about how health is evolving, remote patient monitoring is becoming more and more important. telemedicine, and most of that is in the mental health space. So one of the things that we've seen, which is really interesting with the pandemic, of course, at the height of the pandemic, when we were locked down and before we had the vaccine, telemedicine and remote healthcare shot through the roof. And it shot through the roof really with more kind of medicine-related healthcare and physical healthcare. What we're seeing now is that's decreasing. Many people also are wanting to be seen face-to-face for their physical health. But mental health is very important for how we're going forward, and much of that is staying in that space. So it will definitely be covered. It will come up. And, I would imagine that one of the optional modules will, be around this very important topic of kind of social care and how health care and not just physical care, but physical and mental care is moving out into the communities. So you will get that aspect of mental health, but in terms of a direct module on mental health, we're really offering business and management courses. And so it will be part of that narrative, but it wouldn't be a direct course. Can this MBA help students establish their own consultancy business? Well, absolutely. You will be getting the business and management skills that you would need. So if you want to, take those and create a consultancy business, and many of the people actually who will be coming in speaking to you, one of our visiting professors is a very well-known consultant. His name is Mark Brunell. He's got a great book you might want to take a look at. It's called In Search of the Perfect Health System. He teaches on our program. He's currently a senior exec at KPMG. So, and we have other people from the kind of healthcare consultancy space who will be coming in and engaging with you throughout. So I would say this would be definitely an opportunity to understand and prepare for such an endeavor. How can we book an informal meeting with you? So if you go on to our MBA site, and I believe there's an inquiry button there where you can ask our admissions team to set up an appointment to have an informal chat with me. How much weight is placed on the GMAT for entry? As I said to you, it is just one variable. So it's about you as a whole person. So I wouldn't worry too much about it. It's more about helping you and helping us understand your starting point. It is not going to be neither the GPA or the GMAT, neither one of them is a go, no go. This is about looking at all of those aspects. We don't ask you for a personal statement and a CV and all this information and then get it down to one variable. All right. So this is a holistic approach that we take and a very thoughtful approach. So I wouldn't, again, get too worked up. I would take some practice exams. I would, and then I would take the exam and I'd submit the score alongside your other components, and on each step try to build a very strong case. If there is some reason that you would need an exemption, again, you can write to us and we can review that. When we need to apply, when is the next program is starting? So the next program starts in September of 2022. Our applications are open. Ideally, we'll start to review applications in February and look to start to set up interviews, in late February, early March. So the sooner you can get your application in, better. We ideally like to have, the applications in by late March at the latest. There's no doubt about the excellence of UCL as a university as a whole, and particularly in the areas of medicine and health, but wonder about its business prestige. Could we assume that students pursuing this program will be regarded as equally capable of assuming management roles as one of the graduates from LBS? Absolutely. I think just to Eduardo, give you just a glimpse, this school, the Global Business School for Health, we have been rated, and you can find probably on our website, one of the top 10 business schools to watch for 2022. So, we are a disruptor. UCL is a disruptor. We are a great university, but this is going to be and is a great business school. So I would imagine, particularly if you're going into the health and healthcare space, you will fare excellently. I would not hesitate or worry about that. Do candidates with 18 years of work experience and looking to transition to leadership management role in healthcare industry consider, and would they have to take the GMAT, GRE? Again, you can write to us and we can consider an exemption. If you want to send us your CV and any kind of transcript, we can definitely consider that. So, ideally, if you can take the GMAT or GRE, or if you've got a score, we prefer that. But if you feel that you should get an exemption and have that case, please do make it. Does the MBA cover the relationship between blockchain and healthcare? It could be, Samantha. I would imagine that, in the digital health analytical component of our program, if it didn't, you could probably talk to the person who's teaching that, who is of course an expert in health informatics, and ask them to do that. It's not direct. We don't have a direct module about blockchain and healthcare, but I'm sure that there will be opportunities for you to explore that. And if not, as I said, you might want to explore those with the academic individually. Okay, so I think that's all the questions I've got. I'd be happy to take any more questions if anybody else want to throw one last question up. It's been great having the opportunity to talk to you. I believe that this really is an exceptional program. It's an exceptional experience for individuals that really want to get in and make a difference in health and healthcare management. So anything I can do, anything we can do as a school to help you with your decision making, to explore your application, to support you in any way as you go forward, we are here really to help you. This is our flagship program. This is what the Global Business School for Health is all about. We really do want to make a difference and be the place where tomorrow's leaders in healthcare can really reimagine, redirect, and reshape healthcare management for our larger societies. So thank you so much. I look forward to working and meeting all of you and collaborating as part of this program. So again, thank you for all your time. Now, just as I said that, I think we've got two last questions that have come in. So the first one, what do you need as 2 years work experience? Well, again, I'd be happy to have a chat with you, Josh, about your background and how to contextualize that. I think it's about building that up in your CV, whether that's been through volunteering, internships, direct work, and bundling those experiences into a really convincing work experience application to meet that criteria. And then is a CV required as part of the application process or separate from the personal statement? It is separate, and you do want to have a very good CV. Take your time, really think about what the program, it's like applying for a job. So I would imagine that all of you applied for a job. If you applied for a job, you've had to write a cover letter and you've had to submit a CV. Your personal statement is your cover letter. Why do you want this job? Why do you want to come do this degree? What is it that you're bringing to the table? How do you see this, going forward, and contributing to you and your career going forward? Those are the things, really demonstrating your ambition and what you want in this program. And your CV, again, it needs to be not just a brief CV. Put it all in there. Really, take your time. And can I really emphasize, just like when you were going for a job, remember, make sure, put it through, it Grammarly or, some sort of, do not, make sure it's clean, make sure it's grammatically well done, that it's, got an introduction, that it's got a body that's convincing and in conclusion. I can't tell you how saddened I feel when I see someone who puts a lot of energy into hitting all those boxes, taking the GMAT, getting their transcript, and then they submit a very poor written personal statement. So make sure to have a very strong personal statement, and yes, a CV alongside it. All right, and again, I will just reiterate, I'm very happy to have a conversation with any of you about any aspect of your application, and I look forward to seeing your application. Take care, have a great afternoon. Bye.